Hi everyone. In this video I'm going to be going through sort of a mixed bag of things that I may have missed in other videos when talking about the lymphatic system. So I'm firstly going to talk about the regions of the body that are drained by various large lymphatic vessels. I'm also going to be talking about 3 examples of lymphatic pathologies, so pathologic conditions that can either be present within the lymphatic system itself or present through the lymphatic system. And finally, something that I definitely did miss in my last video when I talked about the spleen was a detailed look at the structure and function of it. I did briefly talk about it, but I didn't talk about it with a model there or an image. So I've used an image in this video to give a better example or a better idea of what the spleen looks like. So let's get started. Firstly, I want to talk about the 2 main ducts that are present in the body and the ducts that allow for the drainage of lymph fluid from various areas. So firstly, as we have on this image on the right, we have what's called the thoracic duct. Now, the thoracic duct is responsible for the drainage of lymph from both sides of the body inferior to the diaphragm. So let's draw in the diaphragm, let's say here, and this is assuming that the diaphragm obviously moves up and down with inspiration and expiration. The thoracic duct allows for drainage of lymph fluid inferior to the diaphragm on both sides of the body and on the left side of the body superior to the diaphragm. So let's write that down. So drainage of lymph fluid on both sides of body inferior to diaphragm and the left side superior to the diaphragm. And where it takes this lymph fluid from this side, basically, of the body is through to what we call the left venous angle. Now, the left venous angle is something that you may learn when you learn about the cardiovascular system. The left venous angle is the junction of the left internal jugular vein and the left subclavian vein. So to reiterate that, the left venous angle is the junction of the left internal jugular vein and left subclavian vein. Now, this duct begins at a special structure called the cisterna chyli. Now, the cisterna chyli, which is something that I will get into in greater detail in a short period of time, is essentially a sac of lymphatic fluid present at L2 in the abdomen. From this cisterna chyli, the thoracic duct ascends through the thorax to the base of the neck, and it enters the thoracic cavity through the diaphragm with the aorta. And if you can remember, the aorta passes through the diaphragm at the aortic hiatus, and I don't know if I've told you this trick, but aortic hiatus, if we spell it out, this is going to be kind of like a Illuminati confirmed moment. Aortic hiatus has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 letters, and lo and behold, the aortic hiatus or the aorta passes through the diaphragm at level T12, Illuminati confirmed. So that's where the thoracic duct also passes through the diaphragm. And just to make a note that all of the structures that pass through the diaphragm, the number of letters that they have in their name gives you an indication of where they pass through. So aortic hiatus has 12 letters, so that passes through T12. The vena cava, inferior vena cava, let's just take vena cava by itself. Vena cava has 8 letters, and the inferior vena cava passes through the diaphragm at T8. And finally, the esophagus, and for this one you have to use the British spelling or the Australian spelling. The esophagus has 10 letters, and esophagus passes through the diaphragm at T10. So that's something that's quite good to remember as well. Now let's take a deeper look into what the cisterna chyli is, or chyli is. How you spell it out is like this. I'll write it in red. Cisterna chyli. Now the cisterna chyli is, as I said, it's essentially a sac or an expanded sac-like chamber. So sac-like chamber, and it receives lymph from, so collects lymph from the right and left lumbar trunks and intestinal trunks. So what this means is that the intestinal trunks at the very end contain lacteals, and since lacteals are responsible for the absorption of fats, these trunks allow for the absorption of fat from the intestine to then be taken to the heart to then be transported around the cardiovascular system. So the thoracic duct, as I've talked about already, receives lymph from the entirety of the body below the diaphragm on the left side, and on the left side allows for reception of lymph from the head, neck, trunk to then re-enter the venous system via the thoracic duct. Now, the other duct that we have here that is the darker green color is the right lymphatic duct. And the right lymphatic duct pretty much is quite similar in its what it receives from in terms of its area, I should say, not in terms of the actual lymph. The area is quite similar to the thoracic duct. It's just on the opposite side. So the right lymphatic duct receives lymph from the right side of the body, right side superior to the diaphragm, and as it receives blood from the superior side, it also receives blood. So for example, receives lymph, from the head, neck, right arm, and right thorax. So the area obviously is a lot less than the area drained by the thoracic duct, but in principle, if we talk about the diaphragm as a landmark, it's essentially just the same concept, just on the opposite side. Now, in terms of where the right lymphatic duct drains into, it drains into the right venous angle. So as you can see, similar concept, but just opposite side. And like I said, as the left venous angle is the angle between the left subclavian and left internal thoracic veins, the right lymphatic duct is the junction between the right subclavian vein and right internal thoracic vein. So in review, thoracic duct, left side of the body, both sides of the body below the diaphragm, right lymphatic duct only above the diaphragm, and on the right side of the body. Alright, so now that we've explored the various areas through which lymph is drained and goes into the cardiovascular system, I want to talk about our first two lymph pathologies. And both of these pathologies are called lymphedema. The first one that we're going to be talking about is called primary lymphedema. And before we move on to exploring what this actually means, let's break down the word primary lymphedema. Primary doesn't really make any sense to us at this stage. It will make sense when I talk about it. But lymphedema, refers to lymphatic fluid, and edema refers to swelling. So there has to be some sort of swelling due to lymphatic fluid occurring in this case, and that is what is causing the primary lymphedema. So primary lymphedema is, once again, we guessed it correctly, chronic swelling of a part of the body, and this is due to the lack of appropriate movement, so appropriate lymph movement through lymph vessels, so through vessels due to an innate lack of vessels in the first place. So primary lymphedema is when we get chronic swelling, and that swelling is due to a lack of appropriate lymph drainage, and that drainage does not occur because we don't have lymphatic vessels to a physiological number in the first place. And as you can see, this condition can be congenital, developed during puberty, or during middle age. So this condition is quite serious, since if you don't have the appropriate number of lymphatic vessels in the first place, that's going to be quite difficult to adequately allow for the drainage of lymphatic fluid. So primary lymphedema, once again, is chronic swelling caused by a lack of proper number of lymphatic vessels, which means that the fluid cannot be drained in the first place. Now, the second condition that we're going to be talking about is, you probably didn't guess this, but secondary lymphedema. Now, secondary lymphedema, and I do apologize for the title being a little bit towards the side, is caused when there is a blockage of lymph vessels, which causes for the fluid to build up. So once again, we have chronic swelling, but this chronic swelling is not due to an innate problem with the lymphatic system in that we don't have an adequate amount of lymph vessels in the first place. It's due to an obstruction preventing adequate lymph drainage. So this is what causes for the fluid to build up. Now the causes of this secondary lymphedema, as you can guess, is probably not going to be something that the person is born with, but rather it can be caused by surgeries, trauma, such as extracellular aspects getting into the lymph vessels that block them, radiation therapy as well, or even allergic reactions. So, as you can see, the difference between secondary and primary lymphedema is that primary lymphedema and secondary lymphedema both result in, I should say, chronic swelling. However, primary lymphedema is when there is a lack of appropriate lymph movement through vessels, and that's due to an innate lack of vessels, whilst secondary lymphedema is due to an obstruction, and there's nothing wrong with the actual number of lymph vessels being present. It's just that something is preventing the effective flow of lymph through those vessels. So if you're wondering about treatment for both of these conditions, it can be a combination of both physical and pharmacological therapy. Especially physical therapy is important for primary lymphedema. because pharmacologically we can't really regrow lymph vessels, but treatment can include physical therapy such as massaging, and massaging assists in moving the fluid by force to force it to move into lymphatic vessels and therefore be transported back to the cardiovascular system. Or if we have secondary lymphedema, which is more treatable pharmacologically, we can give the person medications that remove excess protein from the tissues, therefore decreasing hydrostatic pressure, and this can include medications such as diuretics. And we can also give them, in both primary and secondary lymphedema, compression bandages, and these are bandages that compress the extremities such as the legs, such as compression socks, and that allows for the force of fluid, lymphatic fluid, from the area that has been affected to an area that is less affected, and therefore lymph vessels in that area can possibly allow for the drainage of that fluid. Alright, so the second group of pathologies that I want to talk about today are actually related to the concept of cancer. And if you can look in this image over here, hopefully you can see that what's wrong is that we have an inflamed lymph node on the left side of this person's neck. And when you compare the way, you may be wondering, well, how did you know that? Well, the best way to try and find a pathology in a patient is comparing both sides. So obviously on this side there's nothing wrong because there is in fact a dipping in of the skin. However, on this side there is a very, very clear swelling process going on here. And what we call this swollen lymph node is called a Virchow's node. So what causes an enlarged Virchow's node, and why is it so important to know? Well, a Virchow's node is important because if an enlarged lymph node is present within the neck, and if you want to get pedantic with the name of this lymph node, this is a supraclavicular lymph node because here we have the clavicle and it's present above the clavicle, so it's called a supraclavicular lymph node. Why this Virchow's node is so important is because if we do have an inflamed supraclavicular lymph node, then this can signify stomach, breast, lung, or blood cancers. So as you can see, this is a very good marker for a lot of cancers, and a lot of cancers who are especially quite virulent and quite dangerous. So as you can see, identifying a Virchow's node early is very, very important. In addition to cancers being identified, infections of the arm, so maybe some bugs being present within the arm, can also present with a enlarged Virchow's node. So if we look at stomach cancer as an example, we'll go into it a little bit deeper. Stomach cancer remains symptomless when it metastasizes, and this metastasizing can allow for cells to aggregate within the left supraclavicular lymph node, which is the lymph node that I have circled. And this is what's called a Virchow's node, which is where the drainage of most of the body's from the thoracic duct occurs. So if we look at stomach cancers, so stomach cancers is asymptomatic when it is metastasizing, and when it is metastasizing, these cells usually metastasize to the Virchow's node. So even though the patient may not experience any stomach pain or stomach manifestations due to the cancer, the clinician can adequately and early identify the presence of that enlarged node to get ahead of the cancer and probably start treatment before it gets serious. So in review, the Virchow's node is an important node because if it is enlarged, it can show the presence of stomach, breast, lung, or blood cancers, as well as the presence of infections of the arm. And it's especially important in stomach cancer because the patient may not realize that they have that cancer, because when stomach cancer is metastasizing, it is asymptomatic, and these cells that metastasize from the stomach usually move into that Virchow's node because there is a large amount of lymphatic fluid that flows through this node from the thoracic duct before it re-enters the cardiovascular system. So knowing that this enlargement of this node is important, and knowing that if it is enlarged, what this may mean can save a patient's life.